Hello guys and welcome back to my YouTube channel. Today we are talking about essential oils. It's gonna be painful. Let's just get into it. So when I hear the term essential oils, I think of Young Living and doTERRA peddling cancer cures with essential oils. And besides the fact that this is extremely illegal, it's also very manipulative and dangerous. doTERRA put this picture out at one point alleging that these essential oils will help your adrenal gland function. Just 3 drops of clove, 3 drops of nutmeg, and 7 drops of rosemary. Do you even know what the adrenal glands do? Okay. Second off, do you think that absorbing them through the skin, they just go straight through the skin right to the gland? Like, do you think that's how that works? Like through the skin, through the muscle, to the gland? I don't think that's how that works. I don't think so. Okay. Young Living also made claims against prostate cancer. Now, let's break this one down, because this is another one where it just, if you get close enough to the prostate, I guess you'll hit it. Like, this gives a prescribed dose of mLs per body weight, per pound of body weight. So it's a weight-based drug, but usually we don't do weight-based drugs in pounds. They do them in kilograms because, okay, so this is obviously just something that they made up. And if you read below where it says retention, inserting 10 drops of frankincense and sandalwood mixed with 1 tablespoon of carrier oil and retaining it in your rectum. Okay. Again, with just getting close and thinking that's just going to absorb, they do prostate exams through the rectum because you can feel if the prostate gland is enlarged because it is near the rectum. Just getting close enough, like, not really going to cut it. So this is just made up bullshit. And in the paragraph above, it recommends rubbing a certain amount of drops on the lower abdomen. So it'll go around the bladder because it's not for the bladder. The oils are smart, they know where they're going. Around the bladder to the prostate, but not too far. It doesn't go too far to the testicles. So no worries, you won't get this on your testicles. It'll just go around to the prostate, targeted. Very, very targeted therapy. It also recommends intermittent fasting. Not even gonna touch that right now. And then at the very, 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 very bottom, it says that this is not used to diagnose, treat, or cure, or prevent disease. Consult your physician.
Really?
So these are some say this, not that suggestions from Young Living. So instead of saying, I replaced my thyroid medication with Thyromin, you should instead say, I use Thyromin to nutritionally support healthy thyroid function. Okay. Instead of saying, I diffuse RC to help with my daughter's asthma, you should say, I diffuse RC to create a comforting aroma. Completely different. Completely different. And you're also not allowed to imply any medical terms as well. In this next picture, you can't even, these are hot words that you're not allowed to say if you sell Young Living. Please do not restate, describe, or imply the hot word without actually using it. So don't use any of these terms. ADD, ADHD, Alzheimer's, antidepressant, antiviral, arthritis, autism. Don't say it. High blood pressure, fibromyalgia, Ebola. We got in such big trouble for claiming that these treated Ebola. Ebola! Diabetes, cancer, PTSD, MMR, measles. Y'all are the problem with this measles bullshit. I'm not even going there today. It's y'all's fault. You're young living and your essential oil bullshit, it's y'all's fault. Nope. The issue with essential oils in general is that they are not as well regulated. They're not regulated by the FDA at all. And they're not as potent as medications that we can already make to treat diseases. So why would you use the one that kind of sometimes maybe works for one that most of the time works in most cases and has been proven through human testing, human trials? So I'm going to flash up a excerpt of this study in the Indian Journal of Endocrinology and Metabolism. So it looks very professional. It was accepted into the journal. It was published. This is a published article. And I'm just going to point out a few things that don't quite make sense to me, and that's something that I would not expect to see in a published medical journal. So this clinical trial was related to black cumin to treat diabetes. It showed a highly significant decrease in body weight, waist circumference, and systolic blood pressure. Okay, highly significant. So like 10 points in systolic blood pressure or like 2? What do you consider highly significant? These are not very concrete words. These are up to interpretation. It also says that there was no effect or little significant effect on glucose, testosterone, diastolic blood pressure, cholesterol, but that was probably due to the low dose. Who uses probably in a medical journal? No one uses probably in a medical journal because it's a medical journal. It's science, scientific fact only. So, as much as this article looks real fancy and it was published and everything, I don't know that I really trust it because you're using real non-descriptive terms and you don't even give us the data. Like, it was used to treat patients with diabetes and it was concerned about their glucose level, their cholesterol level, their waist circumference, their body weight, blood pressure, blah, 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 all these tests. But you don't give me any before and after tests. You don't show me any of the actual data. You just say it. That's not a scientific journal to me. I don't know. That doesn't make sense to me. And another hot one is lavender treating cancer. People love to peddle their bullshit about cancer treatments. You know what works on cancer? Chemotherapy, radiation, surgery. Does it work all the time? No. That's why we continue to do research. But you know what doesn't work on cancer?
Lavender.
In a study, a inhaled aromatherapy, lavender, bergamot, or cedarwood oil showed no change in the anxiety of the patient during radiation treatments. Inhaled ginger oil did not decrease any vomiting in patients who were getting chemo. It did produce results that some people experienced decrease in nausea. Okay. You know what else decreases nausea? Anti-nausea medications. So if it only did it in some, we already have medications that work better than that. So they also used inhaled bergamot on kids getting stem cell infusions. It actually increased their anxiety, and it did not have any effect on their pain. So it was having the opposite effect that everyone's peddling. So here are some actual positives related to essential oils. So I'm not going to just bash the entire time, even though it is proven in this study that massaging Roman chamomile does reduce anxiety. With 6 different aroma sessions with this, it did show to reduce anxiety, or you can inhale it 3 times a week for 3 weeks. Lavender, peppermint, chamomile at night helps improving your sleep, decrease your tiredness when you wake up, increase your appetite, decrease your depression, anxiety. And this was tested on people newly diagnosed with AML. Also, it showed that inhaling lemon or ginger essential oil increased salivation. So I just want to point out like one thing here that kind of jumps out at me. What else makes people salivate? Is it maybe smelling food? Is ginger and lemon considered food? So if you just put a plate of food next to them, will that increase their salivation because that's how our body tells us that we want to eat the food because we smell it. This is just the most bogus result ever. Like, if you like the smell of ginger and it makes you hungry, then yeah, you probably will salivate. This is so dumb. They put felt pads soaked with lavender and sandalwood on patients, and it was shown to decrease anxiety during breast biopsies. We're gonna get to the anxiety crap in a minute. Give me some time. Last one, inhaling lavender reduced pain of needle sticks in their chest ports. So here are some negative reactions that people have had to essential oils. Lavender and tea tree oil have been shown to cause breast tissue growth in boys and young men who use too much of it because it blocks testosterone and mimics estrogen, which produces breasts. So don't grab your teenage son and just rub lavender all over him unless he is trying to transition because he did not want breasts. A lot of people have also reported contact dermatitis from prolonged use, and a lot of these are sun sensitive, they're photosensitive essential oils. So if you, live in the daytime and you have it on you, you can have some serious issues from it. There is an article written by Katie. She is a blogger and a YouTuber. I'll link it down below. This woman was using essential oils in a diffuser and it sprayed up at her and burned her.
Ridiculous.
So the FDA, as I said earlier, does not regulate these at all. So the concentration can literally be anything and the purity can literally be anything. There's no regulatory system on it. And even if they call it organic, it only has to be like 51% organic to be called organic. And that even applies to the food in the organic section at Giant Eagle. So people come up all up and, oh my god, it's organic, it's natural. Cyanide and arsenic are natural too. Alright, so let's talk about anxiety. So anxiety and depression are clinically treated illnesses. People are peddling essential oils to treat that, and these studies do prove that those help reduce anxiety. So when I smell a flower, when I smell a rose, for instance, the smell is nice, makes me feel good, releases serotonin in my brain. So I assume that smelling any other flower, like lavender, for instance, would probably do the same thing. So it's not like a clinical treatment, it's just something that happens. And serotonin is something that affects the way people feel, anxiety, depression related as well. So why not just use these instead of actual medications? I'll tell you. Let's talk about SSRIs, selective serotonin reuptake inhibitors. These are common medications used to treat anxiety and depression. So these medications work in two ways. First, they boost your serotonin levels, similar to lavender or perhaps a rose or any other flower that you might like. And the way it maintains it is it blocks the reuptake or reabsorption of the serotonin. Therefore, there is more serotonin in your brain circulating around and making you feel better. So while lavender may increase it, you'd have to literally constantly have a lavender mustache in order to maintain, whereas a SSRI will continue to maintain because it not only produces more, but stops you from reabsorbing it back and just reducing it back again. There are some animal testing cases that show that essential oils are beneficial. One test showed that lavender had anticonvulsant effects when added with narcotics in male mice. It's really oddly specific. And how do you know it wasn't just the narcotics or it wasn't just the lavender? It seems weird that it's combined. Anyway, it also showed that it increased dopamine in the olfactory sense, the nose, in mice. So, let's talk about animal testing. 115 million animals are tested annually for medical purposes. Here's the issue with animal testing. It means nothing. Yeah, it means nothing. The reason that we do it is because people expect it, and it's something that we think actually has an effect on whether or not it goes to human trials if it passes animal trials first. You think that, but it really doesn't. And why do we use mice in the first place? Mice are the most genetically significant to humans. But they're not just like mini humans. They're not just like genetically the same, just smaller and hairier humans. They're a completely different animal. They're at least a mammal, but they're a completely different animal. So when you test something on a mouse and then test it on a human, it's going to have different effects because we're different genetically. The diseases that they are testing and treating process differently between a mouse and a human. So testing on mice really has no effect on if it will or won't work on a human. There's really a lack of consistent evidence that shows that there's any correlation between the way the diseases works in mice and humans. There's no clinical evidence that shows they're similar at all. And there's also studies that show that the conditions of the lab affect the mice. If you were in a cage with no sunlight and no companions in your own cage, and you constantly saw your friends getting their heads cut off because they were done being tested with, don't you think you'd be a little messed up? Don't you think? Obviously, there's a lot of stressors in that environment alone, and then when they're done with the mice, they just like kill them. So then these other mice are seeing their friends getting chopped up or whatever, and it's very stressful. Very stressful for another mouse to see that. It's very stressful for me to see that. I don't want to see that. So animal testing really doesn't prove anything. All these other tests that I talked about earlier in this video were done on humans, but these two results that proved that essential oils were helpful were only prove that it's helpful in mice. So that's my rant on essential oils. I did a lot of research. I'll link all my results, all my web pages down below. I went after essential oils because it's a common occurrence in all of healthcare, not just cancer treatments. The issue with essential oils is that people are using them to replace actual medicine when they can be clearly used as a supplement, not as a full-blown treatment. There is no concrete evidence that any essential oils can cure cancer or any other diseases. They may benefit you if you have anxiety or depression. I think that having things around that smell nice would make me feel better too. I always have a candle lit at home. So I don't know that's really anything concrete necessarily. And it does, even though they do have those effects, they don't have as strong effects as medications that we already produce. So I just don't see any benefit if the patient wants to have aromatherapy, a little smelly whatever with them while they're having something done or in their room. As long as their patient doesn't have respiratory issues, that's fine. Go ahead. But it's not going to cure whatever you're in for. Thank you guys so much for watching. Comment down below. Tell me what you think. Tell me how you feel about essential oils. I'd love to hear it. And I'll catch you guys in the next one. Bye.